Unfortunately, this area sees these negligent driving accidents a couple times a week. Not anything you ever want to get called to, but we have to go to it far more often than we want to. A lot of times you'll see that it is a car full of young kids or something along those lines, and whether it be looking down at their phone because something popped up or they're distracted with the other people in the vehicle, but just the distractions all around them are what lead to these kind of accidents. Bad car wrecks, you'll see everything from patients with serious injuries to their face, unrecognizable, limbs that are either completely gone or partially gone or actively bleeding out, and it's our job to kind of come in and mitigate all of these things, whether it's give them an airway or stop the bleeding.
As crews arrive on scene, our top priority is always scene safety. Not just for our first responders, it's for our patient as well as any bystanders. After that, we rapidly evaluate the situation, trying to determine life-threatening injuries, and then at that point we determine if it's a load and go or it's a stay and play type call.
I've unfortunately been part of many of those incidents. Typically when the patient arrives, you have a pretty good idea, especially through experience, looking at their injuries, whether it's amputations or severe head injuries or just the way they may be moaning or acting. You have a pretty good idea. Usually the police are actually there, and the police usually come in the moment the patient arrives, especially if it's a car accident, because the police need to know if the patient's going to die so they can set up a homicide investigation. When the patient arrives, there's usually a team of emergency medicine, anesthesia, nursing team, radiology, and orthopedic surgery and general surgery at the bedside. At that point, there's a rapid assessment. Then at that point, it's determined whether they're going to live or die or go to the OR. Quite frankly, that's a normal everyday occurrence. 75% of traumas involve distracted driving, impaired driving.
Not just you, it's about everybody on the road you're affecting, right? It's not just you, it's the driver that's in front of you, behind you, the first responders who's trying to get around you. It's about everyone that's on the road, not just about yourself.
I think one of the biggest things is that for every patient, young kid that we see, and it's terrible when we get on scene and see that it's a kid. For every one of those that we do see, there may have been one or two more that just we never even got a chance to transport because they didn't make it. Someone's decisions to be distracted and just look down at their phone while they're driving down the road caused someone else's life to be taken.